And what is the mission of GATC?
Well, I think GATC is using artificial intelligence to help promote diagnosis and treatment of disease. My focus is in diabetes, and we have some applications in that, but we were today talking a lot about addiction and some of the uses and the individuals that are supporting that activity.
Mm-hmm. I mean, I have to imagine that this technology will speed things up quite a bit. Can you speak to that a little bit?
The artificial intelligence and the ability to predict, and that is done at rapid speed compared to other research. We can screen drugs very quickly. We can identify promising avenues without having to spend a lot of money. So it's not only fast, but it's also very effective in screening and moving forward.
You have extensive experience with diabetes. Can you speak to how this technology will help and improve the diabetes epidemic?
Absolutely. So diabetes is an epidemic in the United States, all over the world. Billions of dollars are spent every year treating diabetes and diabetes-related complications. About close to 20% of the healthcare dollar is spent on diabetes. So it's a huge problem. So what we're doing is using artificial intelligence and some of the algorithms that have been developed to try to predict who's going to get disease, who's going to get type 1 diabetes and type 2 diabetes. And then once we know somebody has a susceptibility to getting the disease, we can then look at therapies and treatments and modalities to try and treat them so they don't ever advance to actually having diabetes. So it's an early project, but it's a very important project. We really have the ability to detect and then the ability to treat and cure these disease. The standard assay for detecting somebody's level of how sick they are with diabetes is an assay called the hemoglobin A1C. Mm-hmm. And that's a retrospective number over their blood glucose over the last 90 days. Okay. So it's retrospective. What we're trying to do is develop prospective assays so that we know immediately what their blood sugar is mm-hmm. and then prospectively, can we predict 3-5 years in advance, knowing what the certain blood parameters are, and there's a group of about 10 to 12 of those that we're investigating, we'll be able to predict if somebody's going to advance to actually have diabetes.
And so the AI technology that GATC uses can speed that up significantly.
Absolutely, and that's the real opportunity of this predictive health, is to be able to know when it's going to happen before it does.
Fantastic. Well, good luck with that.
Thank you very much.